Hi, Mike Keenan coming to you from KM Fitness here in Manasquan. I want to talk to you about one of our programs that we use here called rest-based training. What basically that means is that the client is always in control of how hard and how long they're going to work. The words we use is go until you can't, rest until you can. We're not trying to get you to quit, we're trying to force you to rest. So let me give you an analogy that I used to use when I was in physical therapy. Here you see a very crude drawing of an electrical stimulator with leads and pads attached to someone's foot. An electrical stimulation can be used to strengthen muscle. It can also be used to help to relieve pain. So a lot of times the therapist would turn the knob up to increase the intensity of the electric flow going to the foot or the other body part, whatever it was. But most of the time we would put the device close to the client and we would say, take as much as you can so that you're getting the benefit from the therapeutic electrical stimulation, but go until you can't tolerate it anymore. In other words, you decide how much electrical flow was going to go into your foot. And when we did that, the clients inevitably would turn the machine higher than if we turned it up ourselves. And the reason for that is the client felt like they were in control. So they received a beneficial dose of electrical stimulation for either the pain relief or to try to stimulate the muscle to get the foot muscles to contract. So having someone be in charge of the intensity of their program allows them to work harder. And we see the same thing with exercise. You know, we don't tell people, okay, now it's time to rest. We say go until you can't, and then rest until you can. And inevitably, they will push themselves harder than I could push them because they always know that they're in control. So, what do we do with as far as letting the client be in control? Well, it might be how much weight they're using, how many repetitions they perform. I may set up a time, say, okay, we're going to go for a minute, and you go until you can't, rest until you can, and they'll try to push through for that minute, but knowing that if they need to rest during the course of that minute, they can rest. And I'll say, great, when you feel like you're ready to begin again, you start up again. So what is the desired outcome that we're trying to get with the exercise with regards to some of the subjective and objective measures? First of all, I have 4 things here. I have breathlessness, burning, heat, and heavy. Okay? With regards to breathlessness and burning, when we get to that point where the muscle's really burning and the person's getting short on breath, we know that we're starting to get a lactic acid response. And lactic acid will not form in the presence of oxygen. So if the person isn't able to get enough oxygen into the working muscle, they're going to start to get that breathlessness, they're going to try to catch their breath, and they're also going to feel that burning, because as the lactic acid goes up, the pH changes. You get more of an acidic pH. Okay? As soon as they catch their breath during the rest and they take more oxygen in, the lactic acid converts back to something called pyruvate. And pyruvate is used in the burning of sugar and stored body fat in the cells of the organelle, I should say, within the cells called the mitochondria, which you've heard me talk about in the past. So we're getting a lactic acid response. That lactic acid response is the key that unlocks the door to the release of the healing compounds in the body. That could be things like human growth hormone, testosterone, and other tissue repair hormones. We're also getting a hormonal response. We're getting an increase in epinephrine, norepinephrine, the reproduction of the fight or flight response. Okay? And with that, we start to increase our fuel burning capacity and all the other desired benefits. Let's talk a little bit about heat, because I mentioned that earlier. We're getting an increased thermogenic response, and we're also getting an increase in fuel burning. Now we know that when sugar, carbohydrate burns, one of the things that happens during that process is we get a production of heat. So we can start to see the person perspire. But also, it's not just the heat that's being built up through the exercise. The sweating is also another aspect of the hormonal release. Okay, if you're sitting in an office and you're in a high-pressure meeting and you're not moving, you still may start to sweat. So that's indicative of the hormonal response. And heavy. The reason we want to go as heavy as tolerated is because we want to get the most number of muscle cells or motor units firing simultaneously. Think about having a 6-cylinder car and how much fuel it can burn, as opposed to a 12-cylinder Jaguar, that you have much more ability to burn fuel because you have 12 cylinders to burn it in as opposed to a smaller 6-cylinder car. So we're going to increase the fuel burning capacity because we have more motor units working, more engines being running at the same time, but we're also sending a very strong neurological signal to the brain and nervous system saying the muscle's ability to perform this task is not up to what you're asking it to do. So the body will then turn around and start to do things like increase the number of mitochondria within the cell, or start to build the muscle up, start to increase the amount of motor units, the myofibrils will start to increase, the muscle will then have more ability to store fuel, so the muscle will also start to get thicker and stronger, and you'll see more pronounced definition. So, with regards to our rest-based training, this is a premise or a little overview of what we do. So keep in mind, when you're doing rest-based training with us, you're always in control. Okay? We're going to uplift, we're going to encourage you to do the best you can, but you're also going to hear me say, that's great, I want you to rest. You need to rest. Okay? And that allows us to continue to go through. So check out some more videos. You're going to see some evidence of rest-based training in the next couple of videos you'll be seeing here on our YouTube channel. If you haven't had a chance to yet, please subscribe to Keenan Fitness or Keenan Medical Fitness on our YouTube channel, and you're going to see a link for that in your email as well. Okay? Take care, and we'll see you real soon. Bye-bye.